What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my statistics playlist. In previous videos, we talked about the measures of central tendency, such as the mean, the median, and the mode. We also talked about bimodal distributions, how to calculate the range, sensitivity, specificity, positive predictive value, negative predictive value, positive likelihood ratio, negative likelihood ratio, incidence versus prevalence, and so forth. Today it's time to talk about study designs. In biostatistics, we can create a case series study, a case control study, cross-sectional study, prospective cohort, retrospective cohort, ecological studies, twin concordance studies, and adoption studies. And there are the famous randomized, double-blinded, placebo-controlled clinical trials. Today we shall discuss all of them. Click the like button, click the subscribe button, and let's get started. I have a statistics playlist on this channel as well as a biostatistics playlist. The statistics playlist is for everybody. The biostatistics is geared more towards medical students, nursing students, and any occupation related to healthcare. This video was made possible thanks to a generous donation from Fahd. He requested that I create some statistics videos, so please take a moment to say thank you to Fahd in the comment section. Once upon a time, a dude asked Warren Buffett, "Hey, how can I invest my money wisely?" To which the Oracle of Omaha responded, "Rule number 1, don't lose money. And rule number 2, don't forget rule number 1. How can I become a good statistician?" The student asked. The first rule of statistics is that correlation is not the same as causation. Rule number 2 of statistics, refer back to rule number 1. If you wish to see more videos like this in the future, drop any statistics emoji in the comments. So what does correlation even mean? It means that A and B happen together. For example, Medicosis entered into the room and the lights went out. These two instances happen together. This does not necessarily mean that my entry into your room caused the lights to go out. Correlation is not the same as causation. Just because that A happened with B or even before B doesn't necessarily mean that A is the cause of B. For example, I like tuna. Also, I do not have heart disease. This is correlation. This does not mean that my tuna adoration is the cause of my health. To look at correlation, we have many observational studies. To try to establish causation, we need an interventional studies. So what's the difference? Observational studies, well, you are just observing. You're not intervening. You are letting the chips fall where they may, while just observing from the outside or asking questions. But in interventional studies, you are intervening. You are giving this group of patients warfarin and this group of patients placebo. You did this. You intervened. This is an interventional study. Examples of observational studies include case series, case control, cross-sectional, cohort studies, which come in many shapes, including prospective cohort and retrospective cohort, looking forwards versus looking backwards. We also have adoption studies, twin concordance studies, and ecological studies. On the other hand, example of interventional studies include the famous randomized, double-blinded, placebo-controlled clinical trials, which are done in medicine. Correlation is not the same as causation, is the most fundamental rule of statistics, and it's also the one that is often forgotten, including by smart, sophisticated people who should know better. Now please get a piece of paper and doodle with Medicosis. We have the present here, we have the future here, and we have the past here. Okay. If you're asking people in the present about something that is taking place in the present, this is called cross-sectional studies because I am present at a cross-section in time. We are in the crossroads of history between the past and the future. And as the famous historian Will Durant once said, only the young can live in the future, and only the old can live in the past. Men were most of them forced to live in the present, and the present was a ruin. So, cross-sectional studies ask what is happening right now in the present. For example, do you exercise in the present tense? Not did you exercise before? Or are you willing to exercise in the future? And why do we undergo cross-sectional studies? The answer is to establish the prevalence of a certain disease or phenomenon. Notice that I said prevalence and not incidence. In cross-sectional studies, we are measuring the exposure and the outcome simultaneously in the present tense. If you just want the prevalence of a certain disease, then this is called a descriptive cross-sectional study. But if you want the association of the disease with other characteristics of the population, then this is called an analytical because you're analyzing the population. So that's an analytical cross-sectional study. Please remember that cross-sectional studies are observational studies, not interventional studies. So while they do establish correlation, they cannot establish causation or a cause-effect relationship. And that's it for the cross-sectional study. Another type of study is the one that starts here in the present because we live in the present. And then ask the subject, what happened in the past? What happened? You have lung cancer now. Did you smoke in the past? Or you have mesothelioma now. Were you exposed to asbestos in the past? Or you have cirrhosis of the liver today? Did you have hepatitis B or hepatitis C in the past? Or you have cancer of the stomach today? Did you used to eat nitrosamine-rich foods in the past? When you start in the present and ask about what happened in the past, we call this case control. Case control is a type of observational study, not interventional study. Why do we do case control studies? In order to find the odds ratio. Now, I'm going to give you a negative example and a positive example. The negative example, smoking increases my odds of having lung cancer in the future. That's the negative example. How about the positive example? Receiving the polio vaccine is going to reduce my odds of contracting polio later. And that's the purpose of case-controlled studies. Another type of study is the prospective cohort. You start here in the present and you ask about what will happen in the future. What is going to happen? Such as you find a group of people who smoke cigarettes and a group who does not smoke cigarettes. And then you follow up with them in the future and see whether they will develop lung cancer or not. If some of them develop lung cancer, do we find that the lung cancer is more likely in those who smoked compared to those who did not smoke? This is a prospective cohort study. Why do we call it cohort? Because we take a cohort of people, a sample of people. A group that smoked, that's a cohort of smokers, and a group who did not smoke, that's a cohort of non-smokers. And then you follow up with a cohort. Why do we perform cohort studies, at least the prospective cohorts? It's to establish the relative risk. Example, people who smoke today are relatively at a higher risk of developing lung cancer relative to those who did not smoke. See, statistics makes so much sense once you understand what the flip you're talking about. So let's review. Cross-sectional studies establish the prevalence of the disease. Case control studies establish the odds ratio, whereas cohort studies help us find the relative risk. Cross-sectional studies are concerned with the present. Case control studies ask about the past. Prospective cohort studies ask about the future. What is happening right now? What happened in the past? What is going to happen in the future? All three, cross-sectional, case control, and cohort, are examples of observational studies, not interventional studies, which means they cannot establish causation, only correlation. Cross-sectional studies ask about the present. Why do we do them? To find the prevalence, correlation, not causation. Risk factors, not causes. Next, case control study. Case control, what happened in the past? Why do we do them? To find odds ratio. Next, prospective cohorts. Starts now, goes to the future, asks what is going to happen in the future. Why do we do the prospective cohort studies? to find their relative risk. But hey, medicosis, what's the difference between prospective cohort and retrospective cohort? I'm glad you asked. If you are able to answer these 4 questions, you will understand the difference between prospective cohort and retrospective cohort, and you will also understand case control and cross-sectional studies. So please pause the video and tell me the type of each study. Is it prospective cohort, retrospective cohort, case control, or cross-sectional? Now pause. Now let's do it together. We are in the year 2026 and a group of people have lung cancer today. We would like to see if there was a link or exposure to cigarette smoking prior to development of lung cancer. So we ask them, have you ever smoked cigarettes? If so, how many? Notice there was a link prior to development. We're looking at the past clearly. So if you're looking at the past, it is case control study, which is an observational study. Next, we are in the year 2026 and a group of people have high cholesterol today. We would like to know if high cholesterol is correlated with high blood pressure. So we ask the patient, do you have hypertension? Okay, do you have hypertension right now? Since you have high cholesterol right now, oh, so this is the present, and we call this cross-sectional study, which is an observational study. Third, we are in the year 2026, and a group of people who are currently smoking, and we would like to know who is going to develop lung cancer in the future. Oh, in the future, this is cohort. What type of cohort? Prospective cohort, which is an observational study. Fourth, we are in the year 2026, and we divided people into 2 groups, those who currently smoke and those who do not smoke currently. We asked them who had developed lung cancer before. This is a retrospective cohort study, which is also an observational study. It's important to understand the difference between case control, which is concerned with the past, and retrospective cohort, which is also concerned with the past. What is the difference? Case control is concerned with past risk factors, whereas retrospective cohort is concerned with past diseases. And that's a big difference. Have you ever smoked in the past? That's a risk factor. Have you ever had lung cancer in the past? That's a disease. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. So we talked about prospective cohort, retrospective cohort, case control, and cross-sectional studies. But what is case series? Case series is not comparing between 2 groups. It is just one group of people, usually sharing the same diagnosis, for example, atherosclerosis, or sharing the same treatment, for example, all of them are taking aspirin, or the same outcome, all of them developed a heart attack. Since we are not comparing between 2 groups, but instead we have one group, we cannot establish risk factors. We can neither establish correlation nor causation. Why do we do this then? To talk about clinical signs and symptoms. For example, we notice that many people who suffer from a heart attack have chest pain, or pain in the left shoulder, or pain in the left arm, etc. Next type of observational studies, twin-twin concordance and adoption studies. Why do we do them? To try to answer the existential question, is the fault in us or the fault in the stars? Is this disease genetic or environmental, or is it a mixture of both? Let's start by talking about the adoption study. So here is a family. These are the 2 parents, and these 2 parents have one child that is adopted and one child that is not adopted. This is their biological child, but this is not. Notice that these 2 children share the same environment, but not the same genetic makeup, because one is adopted and one is not. And then we're gonna follow up with them to see the similarities and the differences between the 2. If we have differences between them, there is a very high chance that the differences are genetic, not environmental, since they have the same environment. They grew up under the same roof. As for twin-twin concordance study, it's measuring the frequency of the disease in monozygotic twins and the frequency of the same disease in dizygotic twins. Let's say that we have the frequency among monozygotic twins is higher. We call this the higher concordance rate. And the higher the concordance rate, the more likely that this is genetic than environmental. Why? Because we are certain that these twins started from one zygote, monozygotic, and therefore they have the same genes, whereas the dizygotics started from two separate zygotes, hence dizygotic. Therefore, their genes are similar but not identical, to try to find out whether the disease is more genetic or more environmental. Another type of studies is ecological studies. For example, let's look at the first city. This is city A, and the second city, this is city B. City A has more air pollution compared to city B, which has less pollution. We find that there is more COPD in the city with more pollution compared to the city with less pollution. So we can say that there is a correlation between high pollution levels and COPD. Notice that I said correlation, not necessarily causation, because this is an observational study. So we talked about the observational studies: case series, case control, cross-sectional, prospective cohort, retrospective cohort, twin concordance studies, adoption studies, and ecological studies. How about the interventional studies? The randomized, double-blinded, placebo-controlled clinical trial. In randomized, double-blinded, placebo-controlled clinical trial, you're gonna divide your patients into two groups. Let's give the first group placebo, which is just sugar. It's not an active ingredient. And then there is the patients who are going to receive the new drug. Let's call it drug X. And we're gonna try to establish which group of these will have less blood clots. Let's say that the group that received placebo had a risk of 2% blood clots. Out of every 100 patients or 100 subjects, only 2 got blood clots. How about the group that received the new drug? We found only 1% clots. So is there a difference? Yes. The next step is to try to find whether the difference is statistically significant or not. After that, ask yourself, is the difference clinically significant or not? In this case, it is, because having blood clot or not having blood clot is a clinically significant difference. By the way, this does not have to be placebo-controlled. Instead, you can simply compare between an old drug called the standard of care and a new drug that we're trying in order to get it approved. For example, once upon a time, warfarin was the standard of care in patients who have mitral stenosis and atrial fibrillation in order to prevent blood clots. Now let's imagine that we invented a new drug and we're trying to establish whether the new drug is better than warfarin, the same as warfarin, or worse than warfarin at preventing blood clot. So you divide your subjects into Group A and Group B. Group A is going to receive warfarin and Group B is going to receive the new drug. After that, you run the clinical trial and see whether or not there is a difference. Why do we call it randomized? Because it's random, meaning suppose that we have a person and this person is Adam. This person could be randomly assigned to Group A or Group B. This is random. Adam does not get to decide. The doctors do not get to decide. Instead, a computer is going to choose randomly. Now, why do we call it double-blinded? Because the subjects do not know whether they are receiving the warfarin or the other drug, and the doctors that administer the drug have no idea whether this is warfarin or this is the new drug. This is double-blinded. Next, what is double-blinded with crossover? Crossover means the following. We divide patients into two groups. Group A is receiving penicillin and Group B is receiving cephalosporin for a certain infection. And you continue this until half of the study, halfway through, and then you switch, you cross over. The group that was receiving penicillin is now going to receive cephalosporin, and the group that was receiving cephalosporin will now receive penicillin. That's a crossover. After you do all of this, it will be clear, oh wow, penicillin is actually better, because these patients benefited more when they received penicillin, but then when I switched, the other group benefited more because now it is receiving penicillin. Again, please take a moment to pause the video and answer these again. Those questions are of utmost importance. Don't forget to take a moment to say thank you to Fahd in the comment section. Take a look at the rest of my videos in my statistics playlist. I also have playlists for general chemistry, organic chemistry, biochemistry, physics, biology, anatomy, physiology, cardiology, neurology, nephrology, rheumatology, you name it. If you value what I do, help me make more videos by supporting the channel. Go to buymeacoffee.com/medicosis. There are more than 600 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal or Venmo. Go to my website to download my courses, notes and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math and physics make perfect sense.